Hello and welcome to another episode of Keeping London Healthy. My name is Dr. Mario Elia. Today we're going to be joined by Dr. James Owen. Dr. Owen is a family doctor from Toronto with an expertise in sexual health. So we're going to be talking all about sexually transmitted infections today. Chlamydia, gonorrhea, HIV, syphilis, questions we get about all of these all the time in practice, patients asking for testing. But honestly, a lot of patients kind of don't know what's offered, who to test, what's available, how often should they be getting testing. So we'll be talking about all these issues today with Dr. Owen, and he'll be answering all of our questions about all these topics. So we'll be right back after this message. All right, welcome back. Again, we're really pleased to be joined today by Dr. James Owen. Dr. Owen is a family physician and assistant professor at St. Michael's Hospital and Unity Health Toronto, and is faculty in the Department of Family and Community Medicine at the University of Toronto. His practice focuses on sexual and gender minority health, HIV primary care, and health of marginalized populations. So thanks for joining us today, Dr. Owen.
Thanks for having me.
So it's an exciting topic, one we've been kind of waiting to do for some time. So I'm glad we have the chance to do it. I think it's fair to say that the demographic of our audience probably skews a bit older. So I'll have the disclaimer right off the bat that if any of our viewers have been married for 50 years in a monogamous relationship, perhaps this is an episode where they're not going to take much benefit themselves. But again, learning more about this can't hurt for anybody. But yeah, thanks for joining us today to talk about sexually transmitted infections.
Very happy to. Yeah, I will say though that my practice skews in different directions. I also have a number of older patients where I have this conversation with them quite often. So yeah, I think that this is good information for everybody.
Sounds good. And I have had a 7-year-old diagnosed with chlamydia in the practice in the past. So it does happen.
Yeah, that happens.
First, we'll start. Patients often come in to our office asking to be tested for STIs, right? That's just kind of a general, doc, I want to come in for testing. But they often don't understand, what we can test for, what exactly we can test for. So let's demystify it a bit for patients. What are we usually testing for when someone comes in and asks for testing?
When someone's coming in asking for testing, depending on my relationship with them, I usually do a little bit of education around STIs, and I tend to sort of break it down, break things down into 3 buckets. So essentially, you've got your viral, sexually transmitted infections, bacterial, and then infestations, things like scabies, which we probably won't focus on today. There's many different types of sexually transmitted infections. Probably the ones that we might focus on are some of the common ones that we see here in Ontario, here in Canada. Viral infections that we can consider like herpes and HPV. There's HIV as well, and certain bloodborne infections. There's the hepatitis viruses, B, C, are ones that we're often thinking about. And then we have bacterial infections, so chlamydia, gonorrhea, and syphilis. And there's certainly others, but those are probably the common ones that I would be thinking about for the average patient that's coming through my door.
And how do we test for these? So you mentioned a few of them there. So, some people, some patients will assume that, one urine dip will test for everything. Some patients maybe will ask for blood work. How do we test for a few of these STIs?
One thing that I always encourage my patients is to be really clear on what you're being tested for, so that you have a sense of knowing that the tests that are being ordered are correct for you. So there's many different ways. So certain STIs can be tested for in the urine, particularly the gonorrhea and chlamydia. Blood tests are required for certain STIs, so syphilis, HIV, the hepatitis viruses, and so on. And then we also use swabs for certain types of sexually transmitted infections. Not a lot of people know that infections like gonorrhea and chlamydia, as well as being present in the urethra where we would pick it up in the urine, you can also have a rectal infection or a throat infection if those are areas of the body that you're using as part of your sexual practices. So we've got swabs, we've got urine, we've got blood tests. And then also the other thing I would say is just sometimes visual exam. You've probably had this too, that someone comes into the office and says, I have a bump and I don't know if this is something or not. And sometimes we're making these diagnoses based just on looking physically at the patient.
For sure. And the history is so important. We have patients who just kind of just blanket say, test me. Like you said, It's important to know kind of how they're engaging in sex, because I have patients assume that a urine test for chlamydia tests for chlamydia anywhere in their body.
Everything.
Whereas if they have, chlamydia, oropharyngeal chlamydia in the throat or rectal chlamydia. Obviously, a urine won't test for that, so it's really important. So when we're asking patients this, we're not just being nosy. We're actually
Mm.
needing this to direct what kind of patients. Should patients be asking for any specific testing that often gets overlooked by physicians? We mentioned kind of sites there, and I think some physicians probably do under test for
Yeah.
for again oral or kind of rectal sources. Anything that you find that patients really should be kind of asking their physicians about?
Totally. Physicians and patients are used to urine tests and blood tests. And I would say anyone with a cervix is probably used to, in the context of getting a pap test, also getting a swab at that time, a vaginal swab or a cervical swab. So those are the things that I think people are typically expect. And they may not be thinking about some of the other tests that we can do: throat swabs, rectal swabs, visual exams, stuff like that. That stuff is really important as well. And it's really felt that, for particularly for infections like gonorrhea and chlamydia, we actually underdiagnose this fairly frequently because, and I've seen this, you've probably seen it too, patients who, let's say, test negative in their urine sample, and then you do a throat swab, they're totally symptom-free, and then we picked up a chlamydia or gonorrhea infection in the back of the throat. So for the right patient who's in a higher risk category for sexually transmitted infections, it may be appropriate to be doing those. We call them extra genital swabs as well, but basically sort of other areas of the body where an infection could develop.
And in terms of who, like people ask, like I would say people probably underperceive their own risk more than overperceive their risk. Who should be asking their doctor for screening? Kind of what's a general approach that you take?
Yeah, I will say full disclosure that the sexual health is a big part of my practice. And so I think for me and my patients, I often, if my patient is coming in and asking for testing, usually I'm going to offer them the test. But as you said, the history that we would take is really important. I want to know what kind of sexual practices you're having. Get a sense if you have one regular partner or if you have more than one partner. I want to know if you have any symptoms, stuff like that. All of that is really important. Generally, the people who I want to be coming in for testing, the people who I hope are coming in, are people who are at potential risk or higher risk of STIs. So someone who's in a longer term monogamous relationship, they are monogamous with their partner and their partner does not have any other partners, then the risk is overall, I think, really low. So I don't need to bring that patient in particularly regularly. However, I have patients who, are in some sort of open situation, or there's what we call serial monogamy, where they have more, they have one partner, that relationship ends, they have another partner, and so on. Those are the folks who should be coming in periodically for routine testing with their family physician. And then some of the highest risk folks, let's say, who have multiple partners in the course of, let's say, a period of a few months, probably should be coming in about every 3 months for testing, whether or not they have symptoms.
In terms of testing, so important for patients to know. So HIV and syphilis, we would generally test with blood. With the bacterial ones, with the gonorrhea and chlamydia particularly, kind of just demystify it a bit for patients. We'll talk about male patients first.
Yeah.
Patients sometimes are worried that we were going to jump right to a swab of their urethra as a means of testing. Kind of help patients out a bit. What do we do to test for gonorrhea and chlamydia in males?
Yeah, so fortunately, that's a common misperception nowadays. Actually, it's very, very easy. So in males, or essentially anyone with you can test anybody sort of in the urine for an infection in the urethra. So it can be as easy as, for gonorrhea and chlamydia, just doing a urine sample, and that's it. You've done a really accurate test for gonorrhea and chlamydia. That would pick up an infection, often with sort of, within sometimes, if the person is having symptoms, it will pick it up if there's something there.
And same for individuals with a vagina. Again, not insisting on swabs.
Exactly.
Table, no need for a speculum exam like we would have in the past. Urine is sufficient for those patients as well. So much less traumatizing, I think, for patients than in the past. Individuals who may have in the past been getting PAPs yearly, and now we're doing PAPs every 3 years. But even with that, patients often assume that they're going for a PAP and they're going to get STI testing.
Yeah.
What should they be telling their physicians to insist that they get STI testing if they want it, and not just assuming that it's being done?
Great question. I think it's just a matter of remembering to ask the doctor and clearly saying, can you tell me what I'm being tested for today? Are we doing a PAP test? Are you doing a swab for gonorrhea, chlamydia, or there can be other infections in the vagina as well, bacterial vaginosis, trichomoniasis, other things. And those, just asking the physician, it's something that I ask all of my patients myself when I'm about to do a pap test. I say, do you want me to do these tests? But I recognize that in a busy family doctor's office, not every doctor asks. So, it's important, I think, for the patient to sort of clarify if that's a test that you want, check with your doctor to make sure that it's being ordered.
And it goes both ways too. Patients get a pap assuming they're getting STI testing. Goes the other way. Sometimes when they get STI testing, they assume a pap's happening. So it's
Yes.
important to
Yeah.
get clarification exactly which is being done. Can a patient have an infection without symptoms?
Absolutely. Yeah. We see that actually all the time, that people can have infections and they're asymptomatic or symptom free. It actually happens more often for infections that are in the throat or in the rectal area. So I think the rough estimate is that something like 40 to 50% of throat infections with gonorrhea or chlamydia, the person reports having had no symptoms at all. So that's one of the many reasons that for my higher risk patients who are at higher risk of having an infection in that area, that I want them to get swabbed. But we see the same thing for infections that we pick up in the urine. Sometimes I'm just doing routine testing for somebody. They tell me when I'm asking them questions about their recent history that they're totally symptom free, and then we happen to pick something up. And often I think those are situations where people are quite surprised. I think, if someone's having symptoms, they're kind of expecting to pick up something. So there can be a little bit more, I think, anxiety and surprise when you pick up something and you've been symptom free and you suddenly think, how long has this been here for? Has it done me any harm? Stuff like that. But I always tend to think about it as a positive. It's better that we picked it up. It reinforces the importance of routine testing for higher risk folks, and then we can deal with it.
Absolutely. What have we seen with STI rates since COVID? Generally, let's just say in the province of Ontario, what have we seen with STI rates?
I'll tell you what I'm experiencing. I'd be curious to know what you're seeing as well. So prior to COVID, what we've seen for STIs across the board, gonorrhea, chlamydia, and syphilis, is that rates seem to be creeping up. And then, of course, when COVID happened, people were not able to engage with their doctor, may not be doing testing as regularly, and it seems like rates of positive tests dropped. Now, that's probably actually just a matter of, we were not testing as regularly. And I do think that some people were, let's say, reducing their number of partners, their number of sexual contacts, and so on. And that seems to be, from what I can tell, sort of the limit of the current data that we have provincially. But anecdotally, I would say now that we're reopening post-COVID, I feel like we're starting to get an upswing again as people are coming back and getting tested. And I think, I think I've come to recognize, at least in some of the patients that I work with, that even though, during lockdown and during social isolation, we talked about reducing your number of contacts, for very valid reasons. People wanted human contact, people wanted connection and so on. People were still having sex. And so we had this period where we weren't testing people. So now I feel like we're almost playing a little bit of catch up to pick up these infections that were kind of out there, but we just didn't realize it. I don't know. What have you noticed?
Yeah, but same. Obviously, like in the first, year, 2020, obviously a big decline in STI, in symptomatic STI diagnosis. Obviously, people weren't coming in for routine testing, just with resourcing. But lately, been seeing an uptick, especially in asymptomatic infections that we've been picking up too, especially kind of in that teen, young 20s group. Again, my demographic kind of skews a certain way too. So, but yeah, definitely something that can't be ignored. I know we're seeing provincial reports about syphilis rates going up too. So I think something we're going to be seeing in the community. We're going to take a quick break and we'll be right back with more from Dr. Owen. Welcome back. Again, we're being joined today by Dr. James Owen. We'll jump to, we talked about bacteria at length. We'll kind of shift over to viruses. So two viruses that we often get asked about testing for are herpes and HPV. So we'll start with HPV. Can you tell us a little bit about HPV and kind of what symptoms it can cause?
Totally. So HPV is probably one of the most common sexually transmitted infections that is out there. I think if you look at what we would call the population prevalence, so the overall percentage of the population that has been exposed to HPV at some point in time. It's somewhere around 3/4 of the population has probably been exposed to it at some point. Many people do not have symptoms. HPV is a virus that is commonly known for causing genital warts, and also certain types of it can be associated with cancers, cervical cancer, genital cancers, anal cancers, and somewhere around 40 to 50% of throat cancers as well have some sort of association with HPV. So it is incredibly common, and many people can be exposed. They may not have symptoms at all, and their body may clear the infection, or the infection could sort of live asymptomatically within the body, maybe never manifest as anything. So, to sum up, I would say HPV, very common, and we see it. There's over 100 different types, and particularly a few that we pay attention to and recognize because they can cause symptoms or they can cause medical issues.
And patients will ask us, can we test for it? And what
Yeah.
do we tell them?
That's a complicated one. So HPV is, I mentioned at the beginning that part of my assessment of a patient is a visual exam, because the majority of the time, the majority of the times that I'm assessing HPV in my clinic is when someone comes in and they say, I have a lump or a bump or something, I need to get it checked out. And we're making the diagnosis visually. Yes, there are tests that are out there that can test for HPV. They are not widely available, though. That may be changing. So there's some very interesting things happening with how we screen for cervical cancers that probably in the coming years, we're going to focus on more HPV testing versus doing the routine pap tests that I think everyone is used to. But to sum up, right now, an HPV test is not widely available. And to be honest, because it's so common, I would actually say it's not that useful in the day-to-day. It's really about sort of, and I'm sure that we'll talk about this, recognizing symptoms when they occur, doing the appropriate cancer screening, and then also prevention of HPV.
One of the neat things about HPV is obviously we have a vaccine available, which has shown to be quite effective in reducing cervical cancer rates and other cancer rates. Who are you typically offering this vaccine to right now?
Yeah, I have discussions about the HPV vaccine with patients all the time. So the HPV vaccine is great. It's approved for folks who are ages 9 to 45, all genders, men and women. And we are routinely giving it now to school-age kids, so grade 7, basically. And the goal is that, everyone who is kind of coming of age and might be exposed to HPV through sexual contact, that we vaccinate them beforehand so that we can prevent future infections. That said, there are a number of patients in my practice who I am offering it to at older ages. We know, for example, that men who have sex with men are considered at higher risk of HPV infection. And so public health will actually cover the cost of the vaccine. Men who have sex with men can get it for free up to age 26. And then people past that age, actually, I will still often have the discussion with them and say, look, it's possible you could have been exposed to HPV. It's probable that you've been exposed to HPV. That said, this could be a helpful vaccine for preventing exposure to strains of the virus that could be cancer causing. And there is very, very little risk of harm from the vaccine. So it's very safe. And so I recommend it actually to a lot of my sexually active patients who have multiple partners.
A question we'll get from patients who've had a history of either genital warts or an HPV-related abnormal pap is what to tell future partners. What do you generally advise patients in terms of telling partners about this?
Yeah, I think this is a really good question, and I think it links to the issue of kind of the stigma around sexually transmitted infections. This can promote a lot of understandable, I think, initial anxiety for folks if they're told that they have an HPV infection or maybe a herpes infection. HPV, if we're focusing on that one, is so common that it's actually not considered, for public health purposes, a reportable infection. So there is no obligation to disclose it. That probably comes in part from the fact that many people can be carriers of a strain of HPV and not know. That said, there's kind of the public health obligation, but I also do think that, in a human to human sort of, being a good sexual partner kind of context, someone may choose to disclose their HPV, that they are a carrier of HPV, or that they've had occasional outbreaks of genital warts, for example. That may be something that they would want to disclose to their future partners. And I think that there's a way that can be brought up in a very sort of, normalized, kind of non-stigmatizing way. And in fact, not in the context of HPV, but in terms of other infections, I've sometimes actually helped patients have these kind of conversations in my office if there's been a lot of anxiety about it. Bring both partners in, and then we can kind of have a 3-person conversation about what this actually means. It's very manageable, not a big deal, and then talk about ways to reduce risk to the unexposed partner.
We'll shift over to herpes. So patients often assume, when they're coming in for testing and we're testing them, that herpes would be included as part of that test. But really, we only really test for herpes in symptomatic patients
Yeah.
who are having actual symptoms. So, for what symptoms do patients typically get with herpes, and what treatments are available for those patients?
Yeah. So herpes, there's essentially 2 types of herpes. Generally speaking, there's the herpes that you can get sort of on the mouth, and then herpes on the genitals, or in the area of the anus. And it can present as often sort of an initial, we call it a prodrome of initial symptoms of burning, tingling, and so on. And then you can get these kind of red inflamed blisters that, not that I recommend this to people, but if you Googled images of herpes, you would see all sorts of scary things. It doesn't usually present as scary as the Google images might show, but it can be these blisters that can be quite uncomfortable for people. The important thing is that it is very, very manageable and very treatable for people who do have outbreaks. There are medications you can take, particularly early on when you first notice symptoms, that can often stop an outbreak from happening altogether. And then for people who, for whatever reason, have frequent outbreaks, you can actually take a daily preventive medication that can suppress the virus and prevent an outbreak from coming on. So we have great options and things that we can do all the time for our patients.
We're going to switch gears over to prevention. So, what methods do we have? I guess we'll talk about STI prevention kind of as a whole first. So, what methods do we have for preventing STIs?
I often kind of will have a discussion with my patients around kind of what you could consider to be behavioral approaches, and then other kind of medical approaches as well. So very briefly from the behavioral side, that might involve reducing your number of sexual partners, or performing or not performing certain practices that may put you at higher risk of STIs. But then sort of on the medical side, we've got a lot of options. So there's vaccination for HPV to prevent HPV. There's frequent testing, for example, so that you pick up infections as soon as they happen and you're not passing them on to other people who eventually may pass it back to you or other folks. There's, of course, everyone is familiar with barrier methods like condoms, for example, which protect the area that they cover. There's also preventive medications. So HIV, for example, there's a daily pill called PrEP that someone could take that would that would stop them from acquiring an HIV infection if they were exposed to if they had sex with someone who is HIV positive and had a detectable virus. And there's other things, there's post-exposure medications, many different things that one can do. I kind of think about it as a variety of tools in the toolbox, and often depending on the STI of concern, I'll kind of explore what each of those tools are and then discuss what may be a good fit for that patient. Because I know, for example, condoms are a mainstay of treatment, but condoms don't work for everybody in terms of what they want out of their sex life. So if that's not the right option for the patient, we explore other options.
Awesome. Thanks so much for all this incredibly useful information today, Dr. Owen. I know you answered a lot of questions that patients often come in with. So again, thanks for joining us.
No worries. Thanks for having me.
Again, thanks to Dr. Owen for joining us today and for all of his helpful advice. So to summarize kind of a few of the key points, if you have any concerns about not only if you're symptomatic from a potential STI, but if you've had any new exposure, so in a new relationship, a new sexual partner, or any concerns about potentially having been exposed, it's important to reach out to your physician and have a conversation about your concerns. And physician will, depending on kind of risk factors, will offer you the appropriate tests. And remember that you don't necessarily need a swab. You don't necessarily need to get up on the exam table to get tested. Blood and urine are often sufficient to be testing for these things. And for prevention, condoms, behavior modification, like Dr. Owen talked about. And for patients who are particularly high risk for HIV, that we do have HIV prophylaxis medications called PrEP, which you can discuss with your doctor. So again, until next time, stay healthy.